Good evening, everyone, and welcome to Ditto Fitness. My name is Andre Ditto. Today, my guest is Dr.Jay Chait. He's a chiropractor. He's been in the business for about 24 years. He's a native New Yorker. He's been involved in sports most of his life, so he's very athletic. He has treated many people with many ailments as far as back issues are concerned. He graduated from Adelphi College with a BS. He gained his doctorate at New York Chiropractic College. He's a father of 6. And once again, we'd like to welcome him to the show. And let's start the conversation.
Hi, Andrew. Anyway, thanks for having me on your show. I appreciate the opportunity.
Oh, you're quite welcome. Let's talk about chiropractic care. I know what that's like because I've been a patient of yours, so that's pretty easy for me to understand. But for our viewing audience who doesn't know, what exactly is chiropractic care?
Yes, chiropractic is a healing art, like any healing art, it's art, science, and philosophy. It's things natural. Basically, we deal with the spine, and through the spine, predominantly, we're able to affect your nervous system. And your nervous system controls and coordinates every function of the body. And what happens is the spine, you have the brain, the spinal cord, the nerves come out, they branch out, and they go to every tissue, cell, and organ, and every cell. And what happens is different stresses, the spine can misalign, and it can affect your health because it's affecting nerve function. And basically, the different types of stresses that cause these misalignments is structural stress, poor posture traumas, accidents, falls, environmental stress, family, relationships, finances, things people worry about and whatnot. And then you have nutritional stress. People, don't eat well. There's a lot of chemicals and things we're exposed to. And this causes the spine to misalign. And these misalignments we call subluxations. And what subluxation is a misalignment of the spine causing improper nerve flow and function. It doesn't allow the body to heal when you have these misalignments. The term subluxation stands for sub is less, luxation is light, so less light, which in turn means less life, that your body's not working to its optimal level.
What happens? How do these conditions occur? And what conditions do you treat?
Well, basically, I don't really treat anything. It's ultimately your body is what heals. Your body has an innate ability to heal, and all I do, if I can find areas of the spine which are innervated to different areas, whether it's to the upper neck, causing headaches, affecting blood pressure, on down, different levels of the spine, I detect and locate these subluxations, and I treat them with what's called a spinal adjustment. Is a type of treatment where you adjust. I don't like the term manipulate because the manipulation seems very general. It's a precise maneuver that we restore function back to the joint, in turn allowing that nervous system to work at its best and allow the body to heal.
I see. So let's take it a step back here. When a person comes into your office, what can they expect? What goes on?
Basically, they come in, they fill out a history form. Upon doing that, they come into my office, I do a consult, I review and go over the history form with them and do the consult and see what is causing the problems and educate them about the structural, environmental, nutritional stress and locate and detect, which of those areas are deficient that are causing their subluxation so that I can help them. And then from there, we conduct a physical, neurologic exam, whatever needs to be done to find out, what's going on with the body. And then we do some x-rays, which gives me a blueprint of what their spine looks like. So this way I know for future treatment what course of action and what I need to do. And then we give a treatment on the first visit, and then they come back for a follow-up to see the feedback from them on the treatment, how they feel, and then we answer a treatment program.
Okay. Let's once again talk about the conditions that you have seen in people and have helped them sort of get beyond. Let's expand on that. What types of conditions have you experienced through people, and What have you done for them?
Yes. Well, I've have helped many people through chiropractic care. They've come in with headaches, blood pressure problems, besides the normal neck, back, and shoulder. Most people think chiropractic is more for the musculoskeletal, but it's more than that because, as I said earlier, the nerves go from the spine to the organ and a muscle. So as well, you may have the back pain, but it could be affecting an organ. And some people who have lower back pain may have high blood pressure and stuff and whatnot. Also, patients who have been with me for many years, 15, 20 years, have had no major illnesses or haven't had to take any medications. They've been very healthy, and that's pretty much basically it.
I see. I hear you talk about that you were able, through your practice, to treat people who have headaches, who have blood pressure problems. What makes that possible? I mean, how does that get tied into chiropractic care?
Well, basically, like I said earlier, detecting an area of the spine where they have the problem, identifying what what structural, environmental, nutritional stress is causing these subluxations, and just going through a treatment program of treating the patient for a while, see how they respond. If any nutritional deficiency need to be adjusted with some whole food supplements, whether it be blood pressure or their immune system is overreacting with allergies and things like that, maybe their adrenals are stressed, so they need specific nutrition to help rebuild them.
Oh, that's great. Let's take a step back for a moment, if we might, and talk about, for those who don't know, sort of a little bit of the history of chiropractic care. I mean, where does it come from, and how did it get developed?
Sure. Well, spinal manipulation is the oldest therapy in the world. It goes back 5,000 years. They have stuff from the Egyptians and other civilizations as well. They call Hippocrates the father of medicine, but I always question that. I think they called him the father of medicine because he had some kind of organized system of some kind of health care, because he did spinal manipulation and he prescribed whole foods. Whether a person had a problem with the liver, they feed them from an animal, an extract or whatever he gave to that patient to help him with that condition. What happened, chiropractic was invented in 1895, September. What happened was a doctor, D.D. Palmer, he was from Ontario, Canada. He had settled into Davenport, Iowa. And what happened was he was a magnetic healer. And some gentleman came, and his name was Harvey Lillard. He had lifted something, and he pulled something out of his back, and he lost his hearing. Well, he reasoned if something popped out of alignment, something needs to be popped back into alignment. So he administered these adjustments over a course of some treatments, and this gentleman's hearing was restored. His son, B.J. Palmer, at a young age, witnessed him to do this adjustment and help this patient. And he became the developer of our profession, where he developed the science, art, and philosophy, wrote volumes of books about stuff like that and whatnot. And D.D. Palmer had opened a school, Palmer Chiropractic, and then he had moved west and opened up another one in California. I think now they have one in Florida. So that's basically what happened.
Oh, well, that's very interesting. I didn't know that about Hippocrates, that he did chiropractic care. That's very interesting.
Yeah.
Let's try to stay on this for a moment. What has been your experience with your patients when they come into your office? I mean, do they come in with expectations of, being sort of cured in a sense? A lot of people use that word. Or do they just come in and just hope for some kind of relief?
It depends on the patient and what they have. Some people come to me, unfortunately, as a last resort. They've gone conservative medical care, medications, and surgeries and things and whatnot, unfortunately. And then they end up in my office, and I'm able to help them. I give them hope. Sometimes, through the consult, when I explain everything and they have an understanding of the condition and what's wrong, and then they have a solution, now they have hope.
Well, that's terrific. Let's talk about the spine itself for a moment as we continue here. A lot of people don't know much about the anatomy. Being a certified personal trainer and so on, I'm kind of familiar with this stuff. I hear the term a lot, neutral spine. What what does something like that sort of mean to you?
That's interesting. I imagine you must be try and be in some kind of proper alignment when you're with your exercises that you're doing or the type of training, which ultimately that's basically what I do is I correct people's spines to make them better aligned. Because I mean, if your spine's not aligned, you have one shoulder higher than the other, and one hip higher than the other, your body's not going to work at its best. Your muscles are wasting energy, and it's going to cause fatigue and other problems. And you know, a lot of times I see people how twisted they are, and I say to them, well, if you had a car out of alignment, would you drive the car alignment? No, it's wasting gas and energy, and you'll crash. Well, why do you live in a body that's out of alignment? You know, so that's very important. Your posture is one of the most important things. Just like you take care of your teeth, you brush. You know, most people are supposed to floss, they don't. Same thing here. Is your spinal hygiene. You know, you should be checked for subluxations after you're born. Those are the first subluxations that occur when you come out of the pelvis when you're in birth. Sometimes there's trauma that occurs, and you should be checked. And that sets the stage for your life for problems down the road. And commonly children have earaches, upper respiratory infections and things, or digestive issues. And then that's something that we can help and detect early at an early age, and therefore sets the stage right for their health for the the remainder of their lives.
So you're saying that chiropractic care is for basically a person of any age for the most part?
Yes.
How does chiropractic benefit sort of the elder population? Why is it more or less significant for them to come to a chiropractor?
Well, what I find with the older population, a lot of them have never come to see someone like this, and unfortunately a lot of their spines are in very bad shape when we take x-rays, and it's very, very tough, and the muscles are very tight, and it takes time to start getting some motion in there and returning some function back to your nervous system and helping them feel better. But they do get a tremendous amount of relief right away. But it just it takes a little longer because so many years of them having these problems. A lot of them are taking all kinds of pain pills and all kinds of stuff, and some of the stuff is causing some of their symptoms, and you have to go through and see, hey, this is something maybe you shouldn't be taking. You should talk to your medical doctor and maybe get off on this because this is probably causing your other symptoms and whatnot.
Okay. I'm jumping around a little bit
okay.
here.
It's good.
When you treat someone, when you give them an adjustment, and they hear that kind of pressing sound when you're pushing down on their back, what is that? What is that all about?
Basically, what happens is, there's components of subluxation, and what happens, one is the joint doesn't move properly. So this, and I'm sure you know from training, there's different types of joint motion. There's the active of the muscle contracting, then there's the passive with the ligaments, then there's a point after that we call joint play or the parophysiologic joint space. What happens is you get adhesions and scar tissue there, and if that joint doesn't move properly, it fibrosis, and that will affect the nerves. So when we do the adjustment and you're gapping the joint in a particular direction to restore motion, what happens is the fluid inside the joint spins and cavitates and releases a nitrogen bubble. There's a bunch of nerve fibers. It's like resetting a circuit breaker. It like fires and to the organs and muscles and kind of resets everything and makes the body work much better.
I see. So what you're saying basically is that when someone comes in for treatment, you start to adjust them, and that sound they're hearing is basically just gas.
Yes.
Oh, that's very interesting. Most people don't know that. I hear a lot of people talking about their bones cracking, and I'm like,
no, we're not crunching the bones, we're crunching the joints, and and then people say, oh, cracking your knuckles are bad, and it's not. I don't recommend doing your own spine. You see people doing that because, as I said, you got to find the direction which way the joint is not moving to adjust it and restore it back to that function.
So, what inspired you? What helped you to decide that this is what you wanted to do with your life?
Well, at a young age, my dad used to sometimes, I lived on the South Shore of Long Island, and the garage door sometimes when it would rain, the water would accumulate near the garage door in the driveway, and it'd be really heavy, and he would bend wrong and pick up the door and been with his back, and he'd be like bent over, and he's like, Jay, you gotta walk me over to the chiropractor. There's a gentleman that was 2 blocks from me. Him bent over, I'd walk him, and he'd lay him down on a table, and he'd adjust him, and it was like, yeah, you hear all this crunching as a kid, you're like, wow. And I was like, this is amazing. All he's doing is using his hands, no needles, no drugs, and he walks out of there. So that was an influence to me. Where I grew up, there was 2 peninsulas. Then there was in kindergarten, a good friend of mine, his father was a chiropractor, so there was like the only two chiropractors in the town. They were in different parts of the town, the South Peninsula. And one day we went to a birthday party, bowling, and we went to his home. I just found the office. I got curious. I was walking around, looking at the tables. I had interest, and that's what influenced me. You know, I was very much into sports, and I got at a young age, got a lot in understanding into nutrition, so I was into natural healing, and I either wanted to be a professional athlete or become some kind of doctor. I didn't know it was chiropractic, but this was something I wanted to do.
Well, that's very interesting. A lot of people are influenced by sort of outside sources, outside entities, if we may call them that, and it's amazing what a person does with, the influences that are in their life, and I never knew that about you, obviously, and that's very interesting. That's a very interesting point in your life, obviously. You talk about you just spoke about sort of natural influences, natural healing. Talk about that a little bit more. I mean, what does that mean to you?
Well, natural healing, for example, your body has an innate ability to heal. As I said earlier, your nervous system is basically your life force. And the way we know that is, when you have a cut on your hand, do you have to think about it healing?
No.
It just happens automatically.
Correct.
And the reason why there's life, there's a nerve supply. If we were to take a piece of meat out of the freezer, put it on the counter here, and I could cut it with a knife, is it going to heal? No, it has no nerve supply, so it has nothing to tell it what to do. And that's basically what we mean by it. The body has ability to heal. It's from the brain down, inside out, and that's even the way we develop neurologically too, and that's the same way, the body works. Outside in doesn't work with the body, that type of healing.
I see. And I happen to believe in that principle myself, obviously. Being a vegan and just the way I take care of my body is very natural, and I take supplements, some for, because I work out a lot, but also because I just want to take care of myself.
Right.
I feel it's necessary to add to my diet or my way of eating, my lifestyle. So let's talk about your a belief that you have here about being a healer. What inspires you to feel that way? What is that?
Well, I just basically help the body along to heal.
That's great.
A doctor doesn't mean God, it means teacher. I educate people about the health, and I try and remove the nerve interference from their nervous system and allow their body's nervous system to manifest 100% function so they can heal and be a well-being and be healthy.
I see. Do you have any certain protocol or modalities that you would implement or use as far as anything natural, or you just...
Basically, when I conduct an exam, I look what structural, environmental, nutritional stress. Basically, if people sit many hours a day, more than 2-3 hours a day, you're going to have low back pain. People sit at computers, at workstations, and they're all head forward, and wrists up high, because I go to companies to fix patients' workstations because that becomes an issue in helping them. I need to remove that stress so that this way I can fix them and allow their body to heal. As I said earlier, if they need in certain conditions, I use whole food supplements because they have that subluxation, but there is a nutritional deficiency and the body needs it to heal, because your body's always, healing, and it needs supplements and nutrients to heal, and you could be deficient.
I see. I mean, that's pretty amazing what you just shared, that you say you go into offices and adjust their space, in a sense, their office space. So would you say that, I'm doing this on purpose, obviously, the way I'm sitting at this point would be proper, would you say? Or I'm a little tight in the chair here, but...
Yeah, It's good. Unfortunately, the chair's a little too high. So
Okay.
as you can see, I'm lifting up my feet down below
Right.
to bring my knees higher than my hips, so it takes the pressure off the back. Because then,
Oh.
if your knees is hanging from the chair, it's pulling on your hamstrings, which in turn is pulling on your back, and you'll feel pressure in your back. Yeah, but pretty much the chair gives good support.
Okay, good. So, can you give people a few pointers, those who have sort of the 9-to-5 job, as far as what they can do to not injure their back, or at least minimize the injury to their back?
Okay. It's crucial to have a chair that's adjustable. If the chair's too flat in the back, you get a cushion to put in to help push the curve in the low back and support. You don't want your chair too high. You want your knees higher than your hips, so a lot of times you have to drop the chair down. You should have a tray, so this way your arms are close to your body, not you're reaching like this and putting a lot of stress to your neck and your shoulders. It's crucial also that your monitor be straight in front of you. And also not too much like the phone and certain things you use all on one side. You alternate it so it's not all on the right side. Other factors also is lighting and glare in the offices, I find, and their partitions and how they are with glare, or glare from the windows, and we make adjustments with that, whether maybe you turn off a bulb or stuff like that. Or going back with the sitting, sometimes some people, they need even a footrest because they're really tall and they drop the chair down, but their knees are still not higher than their hips, so you need a footrest, so this way they can bring their legs up higher, and this way then they'll be higher than their hip.
Oh, that's very interesting.
Yeah.
I'm sure the audience will appreciate the tips that you're,
Yeah.
you're sharing here.
And one last thing, it's also important, you're sitting long periods of time, get up, move around, maybe go out the window, look different distances, because you're always looking at a computer monitor and close, and you're straining your eyes. And sometimes even if you go in a dark room, helps take care of some of the eye strain, because a lot of times the offices are just too bright. As I say, we turn off some of the bulbs and whatnot, that helps.
And if I may say that, I think that's a very good point. Giving your eyes a break, as well as the rest of your body, obviously, is very important in the health, your overall health. Hi, my name is Andre Ditto. This is Ditto Fitness. Today, my guest is Dr.Jay Chait Chiropractor, and we're just discussing sort of what chiropractic care is, and just what goes on when you walk into a chiropractor's office. And it varies from chiropractor to chiropractor, but we're specifically just trying to get an idea of what you can expect if you go to a chiropractor to be treated. Let's just talk about, is there one particular patient or patients that you feel like were kind of success stories for you? Or
you're so into helping and healing people that sometimes you forget a lot of little things, because I'm expected to help everyone, but I've had a lot of miracles. I have a lot of testimonials. Patients who've had asthma, there's numerous cases where they've been taking prednisone, this and that, and they give them hope, and they're off of that stuff, and they haven't had asthma attacks in over 20 years, 15 years they've been with me.
wow.
Let's see, headache sufferers. I've had, I overlooked this. It's so many. I help a lot of people with thyroid conditions and stuff and whatnot. High blood pressure, get them off medications. Diabetes, some people, as a matter of fact, one patient, she had really bad diabetes. She was taking insulin. She was trying to really eat better, and she was doing a lot nutritionally, a lot of things she was already doing, but the problem was the doctor kept on lowering her internist kept on raising her insulin, so it was causing the opposite reaction in the body. And I identified that and let her know. I said, as far as the nutrition and everything and the exercise, you're doing everything right. I said, this is the issue. She went back, and with the chiropractic care and the things I had to do in it, she got off the insulin.
Oh, that's terrific. So that's pretty amazing, that something that seems like simple care in a sense can do so much for you. I mean, I wasn't totally aware of the fact that chiropractic care can treat so many conditions, and I mean, just by being able to, if I may simplify this for a moment, just laying face down on a table and having your back adjusted it's quite amazing that so many things can just develop from that, and just make your life so much different, so much better. That's quite amazing.
Yeah, it's very interesting. The nervous system is very complicated, and like you said, yeah, it's a very simple principle what we do. Take pressure off the nerve, allow the body to heal. You know, if you can find various levels where it's affecting various organs, you help with various conditions and symptoms. It's pretty neat, you know.
Well, I got to say, I mean, obviously you've been in practice for over 24 years, and which means that you must have quite a successful practice, and people must be quite happy with your treatment and just your level of care when they walk into your office, I would imagine.
Yes.
And that they're, you know, quite satisfied. Anything else you'd like to share with the audience in closing here, as far as just, you know, tips or anything that you'd like to share with the
Well, I'd like
audience?
to say that I like to have an offer. Anyone that says they saw me on this show on Ditto Fitness, that I offer a free consult. Basically, you come in, you fill out a history form. I'll go over it with you and let you know that I can help you, as well as you get a free exam. And my office is at 99 Wall Street, Suite 1700, New York, New York. My zip is 10005. You can also look me up on Facebook and Twitter, and it's Dr.Jay Chait. And my email address is drjaychait@yahoo.com. And that's pretty much it.
Would you like to give a phone number, or?
Yes, that would be nice. My phone number is 212-964-6000. Got to get all the social media stuff in. You forget the phone
Right,
number.
of course. That's the age we live in.
I like the old school, but you know, I have all those other things as well. Or you can look at drjchait.com, my website.
And that will list your hours as well.
It has all the information on
Oh,
there.
terrific.
And whatnot.
Um,
And basically, we accept all insurance. But first things, you come in for a free consult, come in for a free exam, and I'll let you know if I can help you.
Terrific. Once again, my guest today was Dr. Jay Chait. It was a pleasure to have you on the show, Doctor.
Likewise.
We discussed many areas of chiropractic care, just from what exactly chiropractic care entails to some of the conditions, as they're called, that can be enhanced by chiropractic care. It's pretty amazing, just by, as I said earlier, just laying flat down on a table there and having your body worked on, what can happen for you. Once again, viewers, thank you for tuning in today. My name is Andre Ditto. This is Ditto Fitness. Namaste. And once again, your health is my concern.